Good Tuesday afternoon. Thanks for joining us on KARE 11 News Now. I'm Janice Shortle. Happening tonight, the University of Minnesota union workers are walking off the job here in the Twin Cities. Strikes are now taking place across several Minnesota campuses. It began last night at 10 when Teamsters Local 320 started striking on the Morris and Crookston campuses. This morning, workers also walked off the job in Duluth, Grand Rapids, Waseca, and Austin. This comes after 82% of the Teamsters union voted against the U's last contract offer, which expired last week. The unions are demanding a 3.5% wage increase, a number they say is comparable to what other campus unions have gotten.
We don't want to strike. We want a contract that we can accept, and it's really up to the university to provide us with something that we can be proud of and that acknowledges our work here.
Teamsters represent 1,400 maintenance, food service, and janitorial staff, and strike is disrupting certain services already. That includes retail dining, campus mail, and emergency maintenance repairs. The university said it is prepared to continue vital services. Well, new video this afternoon shows the moment a bus full of kids was involved in a crash on 35W. This happened near Mounds View at around 7:50 this morning. The State Patrol says a white sedan was trying to slow down for traffic, but it ran into a black SUV. After hitting the SUV, the car ended up in front of the bus and the bus hit it. Investigators say 27 students were on that bus, all of them appearing to be okay. The bus driver and the driver of the white sedan were taken to the hospital. They are also expected to be all right. The highway was blocked for about an hour while all of the mess got cleaned up, and the crash is currently under investigation. Well, please take a look at your screen. Police say Logan Sampson was last seen leaving his house in New Prague on Sunday, wearing a gray sweatshirt and black jogging pants. He's 6'2", weighs 190 pounds, has brown hair and blue eyes. Logan's mom told KARE 11 he has a history of seizures and he could be disoriented. Anyone with information on where Logan is asked to call 911. We are learning today that House lawmakers have elected Zack Stephenson to be the new DFL caucus leader. He replaces the late Speaker Emerita Melissa Hortman. She was shot in a political assassination in June. Stephenson was a volunteer on Hortman's early campaigns, and one of the first things he's going to do is lead the DFL through a special session when it's called. The House is still likely to be tied. Well, it's been a tough summer in the Metro, and to this day, first responders are still dealing with the trauma of being on the front lines of that Annunciation Church shooting and the political assassination of Melissa and Mark Hortman. Raya Katene has a closer look at the toll it's taken on their mental health and how they're dealing with it.
Almost 2 weeks after a shooter opened fire on people praying at Annunciation Catholic School, the first responders, among the first to help that morning, may now be in need of help themselves.
This shooting inside the church was in some ways a breaking point for a lot of the officers. It's not just that one traumatic event. In some cases, it is just the latest traumatic event in a series of traumatic events that they have seen firsthand.
Minneapolis Police Chief Brian O'Hara says it's too soon to know the exact impacts of responding to such violence. It's too soon to tell, he says, if it will lead to some officers leaving the profession.
I think that remains to be seen, but that's definitely a possibility for some.
The chief says Minneapolis Police has 1 psychiatrist, 2 sergeants, and a peer support group made up of 21 officers and staff members dedicated to mental health and well-being.
We had dozens of officers that took some time off from work, whether it's just simply a day, in some cases several days.
It's been a tough summer.
Almost 2.5 months before the Annunciation shooting, Brooklyn Park Police was the main agency responding to the murders of Melissa and Mark Hortman.
There's a lot of officers that knew the Hortmans, and that's a little bit unusual for us. We deal with a lot of death and trauma every day, but we don't always know the people.
Inspector Matt Raby says Brooklyn Park officers involved in critical incidents are given time off from work, and all officers are required to see a therapist at least once a year. Some Brooklyn Park officers were also at Annunciation when 2 children's lives were taken and many lives impacted, including those who were first in line to help.
According to city documents, health and well-being falls within the police department's professional standards division, which last year had a budget of about $37.5 million. Raya did ask the Minneapolis police chief how much of the department's current budget is dedicated to officers' health and well-being. He says it's a small portion of their training budget. Well, happening right now, a well-known violence prevention activist is asking a judge to throw out his wage theft charges. Bishop Harding Smith was in court on Monday, and according to the criminal complaint, the contract Smith signed with Hennepin County required him to pay workers $35 an hour, but that he instead paid most of them $20 an hour. Smith's attorney said he was open about the wages he paid and that all of the money he received went toward Minnesota Acts Now. The man who filed the police report against Smith, Howard Dotson, was in court as well. The attorney Ann Dotson spoke after court.
We think the evidence will establish that there wasn't any deception. He has to, in order to make it a criminal case, he has to intentionally deceive them. And he was very out in the open about how he was paying the workers.
The violence interrupters, the work they do is so essential. They put themselves in harm's way to make our community safe. The least they deserve is a just wage.
The case is going to be back in court in November. Well, in the wake of that shooting at Annunciation Church, community support has been huge, but with GoFundMe pages set up for every victim's medical bills. But as crowdfunding for care grows, so is something else. Hospitals suing patients over unpaid bills. Here's Kent Erdahl.
Even as concerns about medical debt filled the Minnesota Capitol in 2024, medical debt lawsuits were increasingly filling our legal system.
And it makes up a significant part of court dockets across the country.
Lester Bird with the Pew Charitable Trust and David McClendon with January Advisors collaborated on a new report detailing a national surge in debt collection lawsuits, including a return to 2019 levels here in Minnesota.
How does medical debt figure into that in our state?
So medical debt makes up about 14% of all the consumer debt that we're tracking in Minnesota.
In reality, they say it's likely even higher because that doesn't include lawsuits stemming from medical debt paid for with credit cards or debt that was sold or handed off to a debt collector. In fact, the only way to easily identify medical debt lawsuits is when a hospital system sues directly, and some do so more than others.
The safety net hospitals like HCMC aren't filing these cases.
McClendon says Fairview Health Services outpaced everyone in 2024.
Right now, they are definitely the top filer.
In a statement to KARE 11 today, Fairview said, "We exhaust every possible option to support patients," adding litigation is only pursued in rare circumstances, roughly 1% of our clinical bills, and never against patients who don't qualify, such as those with insufficient assets or clear inability to pay. But there appear to be plenty more patients on the margins.
We see a really high default rate or a really high rate of people not engaging in these lawsuits in Minnesota.
Bird says that's concerning because the median filing only involves about $1,500 in medical debt, and 75% of cases are for less than $2,500.
These are for folks who are struggling to meet their deductible, not struggling to pay hundreds of thousands of dollars in medical debt.
I've had to choose between buying groceries or paying a full medical bill.
Cancer survivor Jen Schultz was among those who pushed for Minnesota's Debt Fairness Act last year, which was signed by Governor Walz and began providing some protections last fall.
The protections that were passed in Minnesota were a good step. I think there was some protections to make sure, especially lower income people who were being sued and having their wages garnished would have more money week to week while they pay back sort of debts that were owed.
But if you're still facing a bill and feeling hopeless, they have one piece of advice.
Try to engage in these cases. Try to come to a settlement. If you owe these debts and they're valid and legitimate, trying to come to a settlement. If you can't, reaching out, trying to find legal help across the state.
A lot of folks could be eligible for legal aid assistance through their local legal aid organization.
Worst thing you can do is to ignore these lawsuits. The best thing you can do is try to engage.
One key protection of the Minnesota Debt Fairness Act is that patients who win medical debt lawsuits can get their attorney fees reimbursed, but there's a catch to that. You heard Bird talk about it. Less than 4% of patients ever get a lawyer in these kinds of cases, and that's why he says that step about access to legal aid, making that call, is critical. Well, right now, confusion is growing over the new COVID vaccine as the FDA narrows guidelines at the federal level, and Governor Walz is issuing, or has issued rather, an executive order to protect your vaccine access. Danny Spiewak explains what that means and who pays for it.
In past years, the COVID vaccine has been widely available for anyone 6 months and older. but that's changing under Health and Human Services Secretary Robert F. Kennedy Jr.
Right now, we're dealing with completely different circumstances.
In August, the Food and Drug Administration approved a new round of COVID vaccines, but only for people 65 and older or those 6 months and older with underlying health conditions.
So the calculus is different, and it's complicated.
In an executive order issued Monday, Governor Walz accused RFK Jr. of leading a misinformation campaign. He directed state agencies to work to preserve access to the COVID vaccine and asked state epidemiologist Dr. Ruth Linfield to review guidelines and possibly issue guidance at the state level.
The executive order is really supporting the good works that we've been doing at the Minnesota Department of Health.
Jessica Hancock Allen oversees the Infectious Diseases Division at MDH.
We're exploring if that would be necessary to expand the group of folks that are covered and that could get the COVID-19 vaccine.
CVS and Walgreens tell us the COVID shots remain available at Minnesota locations for eligible groups. But unless you're a senior or have an underlying condition, you can't make an appointment without a prescription.
It introduces more hoops.
Dr. Peter Chin Hong is an infectious disease specialist at the University of California, San Francisco.
We're confused and we're a little bit anxious about the changes. But I think one other way to think about it is the things that are not going to change. And those 65 and older will get the vaccine.
A sign of the times in an announcement from the Star Tribune yesterday. It's closing its Minneapolis printing plant at the start of next year, and it's going to start printing the papers in Des Moines, Iowa. The Star Tribune says to make sure the paper still arrives on time, it moves its deadlines up, meaning some late-breaking stories might not make the print version. The paper says the move is part of its transformation into a digital-first company. This closure of the plant puts 125 employees out of a job. Stick with us on The Plus. More news and weather coming up after the break.